Okay, so we're going to talk about the heart and the peripheral vascular system today. Basically, the overview of this is perfusion. Perfusion is perfusing tissues, means getting them oxygenated, perfusing them with oxygen, and then, of course, the waste products come back out, and that is removed out of our body via our lungs. We breathe in oxygen and breathe out waste products. So we're going to kind of go through the anatomy physiology pretty quick, and that's because we're going to do this in class, more so in class as an activity. But your cardiovascular system, the point of your cardiovascular is to transport your oxygen, nutrients, but then take away the waste products and remove the waste products out of your body via the lungs and the kidneys. Your cardiovascular system can adjust your needs by either constricting or dilating your blood vessels and altering your cardiac input and output. How about that? Your heart, people get all, freaked out about the heart. Well, the heart, the cardiovascular system. Well, heart is just a pump. It's just a pump. That's all it is. It just pumps blood. It's pumping blood throughout your body. Now, it's very important because we need that pump, right? Typical heartbeat, a normal heart rate is 60 to 100, right? Remember, we talked about anything over 100 is tachycardia, and below 60 is bradycardia. You're going to have your two chambers. You've got your atrium and the ventricles. Atrium's on the top part, ventricles on the bottom part. The right side of your heart is receiving blood from your superior and inferior vena cava. Remember, superior means high or above, inferior is below, comes into the heart to your right atrium, then goes down into your right ventricle, goes to your lungs, gets oxygenated, gets rid of the waste, picks up oxygen, comes back into your left atrium, then your left ventricle, and then out to your body. And it's just a big circular motion. It just, blood flow goes all the way into a big circle. Up to the right side is deoxygenated, the left side is oxygenated. The upper part of the heart is considered the base, and the lower left ventricle is apex of the heart. Your heart is not just straight up, it's at an angle. So you'll see this, I think, further along in the PowerPoint, how it does lay at an angle. Your pulmonary arteries and aorta are the great vessels. The aorta curves, that's an aortic arch. Here we go. Here's some lovely pictures here. You can see your heart is here kind of at an angle. This is where your left ventricle is. Here's your left atrium. This is your pulmonary artery. This is your aorta. Your superior vena cava. They don't show the inferior vena cava, do they? But the vena cava, notice it's blue because that's deoxygenated blood. So the blood from the top part of your body goes here to your vena cava and goes into the right atrium of your heart. The inferior vena cava, which is not shown in this diagram, it picks up all of the deoxygenated blood and with all the waste products from the lower half of your body, also comes up here and dumps into the right atrium of your heart. Right here, see your ribs? Oh, here's all of the lovely little ribs. Well, your ribs, in between each rib, that's your intercostal space. Intercostal. I kind of put it in terms of like when I eat ribs. That's, I know, hey, whatever works. But when you cut ribs, like if you cook ribs out on a grill and then you're cutting up your ribs and so that people can easily take their 1 or 2 ribs or whatever, you cut it in the meaty part, right? We don't eat the bones, we eat the meat in between. Well, we're basically, that's your intercostal space. When you're cutting ribs and you're cutting between those bones, you think to yourself, that's the intercostal space. And that's what we count, and that's what we use as our markings for when we listen to lung sounds or heart sounds. All right, I lost my mouse. The heart wall has 3 layers. You've got your pericardium, your myocardium, your endocardium. The heart is in the pericardium. And then you've got, basically it's your pericardial sac. And there's going to be some different heart sounds that we listen to that will, that actually has some meaning to us. We'll talk about that a little bit. We'll talk, like I said, some of the stuff we're going to talk about in class, and so I am going to be skipping over quite a bit of it because we'll be covering that more in depth. Valves, you have valves, and we're going to talk about the valves in class, but you do have 4 valves. You've got your AV valves and your semilunar valves. AV valves are because they're called AV because they're between your atrium and ventricles. So you've got a tricuspid and a mitral, and then your semilunar, and that's because of their half moon shape, but that is that goes from the left ventricle to your aorta, or your pulmonic valve goes to the right ventricle out to your pulmonic artery. Here's a lovely picture of the inside part of your heart with your atrium. It shows your valves. Basically, trying to see if there's anything here that we didn't really kind of talk about. Pretty much of the valves, but again, this is going to be covered more in depth in class. So you have systole and diastole. Systole is the heart contracting. That's the heart giving it squeeze like that, and that's systole. That's your systolic. Then it relaxes, and when it relaxes, I'm trying to get in front of my camera. When it relaxes, that's diastole or diastolic. So now you think about it. When we checked our blood pressure, we do blood pressure, and we do like 120/80. That's systolic over diastolic, right? So 120 over 80, systolic over diastolic. Systolic is that heart squeezing, and that is why the number on the top is going to be a higher number, because there's going to be more pressure when everything's squeezing, right? When it's squeezing, there's pressure. When it relaxes, it's going to be less pressure. That's the diastolic, and that's why the bottom number of a blood pressure is lower. My mouse isn't working. All right, this is showing the blood flow. I'm going to skip through that. Still talking about systole and the valves. So we're going to skip right through that. Now, your heart has blood flow, but it also has electrical conduction. So I know some, like with cardiologists, different cardiologists, some of them deal strictly with the blood flow through the heart. Some cardiologists deal with strictly the electrical conduction through the heart. The electrical conduction of the heart, this is what an EKG measures. So your heart has an SA node. It's a little node, sinoatrial node. It's up in the right atrium, and that is where your heartbeat, that's what initiates your heartbeat. It's called your pacemaker, and that's what gives the 60 to 100 beats per minute. So this electrical impulse goes down throughout your heart, and it innervates your heart, and that's what causes your heart to, your heart's a muscle, so it just causes that muscle to contract. Now you have a backup, it's called your backup pacemaker, is your AV node, atrioventricular node. Now that's going to have a slower heart rate. That's, instead of the 60 to 100, 40 to 60. I was going to say 40 to 60. I wanted to make sure I had it right, because different books say things a little off, but the AV node is 40 to 60. So some people may have their regular heartbeat may be 40 to 60. And they may say, oh, look how healthy I am. I'm so healthy. I have a really slow heartbeat, like an athlete, because, you know, football players and have low heartbeats. But that's because their muscle is so well developed, and that muscle is so strong, it doesn't need to beat that fast, because it's got a big, when it contracts, man, it's got a contraction because it's strong. It's very well developed, so their heartbeat is slow. But that's an athlete. That's like a professional athlete. You have somebody that's not a professional athlete and their normal heart rate is 40 to 60. They may think that they're in really good shape because they have a slow heartbeat. Nah, more than likely their SA node isn't working. As they've get older, sometimes some people, there's something called sick sinus syndrome. Sick sinus syndrome is just that SA node is not generating a heartbeat. So it's their AV node is picking up the heartbeat and it beats slower. So they may think they're really healthy and really strong, but in reality their SA node isn't working. Now, the SA node and AV node, if they both break, don't work anymore, you also have bundle branches, and we'll go through all this in class as well. But the bundle branches can also generate a heartbeat, but it's going to be really slow. It's only going to be like 20 to 40. It's still a heartbeat though, so hey, a slow heartbeat's better than no heartbeat. Here's a picture showing the different nodes. There's your I completely lost my mouse. I wanted to point to it with my mouse, but my mouse is gone. But you can see you've got your SA node. That's what generates that initial electrical conduction. The AV node, you can see where that is, and then the bundle branch is going down the heart. That is your kind of your final source of electrical conduction. Now, when we talk about peripheral vascular system, now you think about peripheral, that's like arms and legs, right? So we've got all these different vascular system. That's arteries, veins, capillaries, any of your microvascular system. So arteries, very tough. They have little smaller branches called arterioles. They are under a lot of pressure. Arteries are high pressure. This is why if somebody cuts an artery, like you'll see even on TV, like they do surgery or something to happen, and somebody cuts something and all of a sudden you see blood spurting out, and that's because it's an artery and it's under pressure. Veins don't do that. Veins are not under high pressure. Veins don't spurt out like that. Sorry, trying to change the slide by my mouse. Veins, say more passive veins. They call them passive. I call them low pressure or no pressure. And because veins, they don't really have that high pressure. Now arteries are going to shoot, the blood's going to shoot through because it's under high pressure. Veins, the blood just kind of goes through it with very minimal pressure. So because of that, your veins are going to have these things, the little valves in them, and that's to prevent the backflow of blood. So you're standing up. What's to prevent the blood from your veins from pooling in the bottom of your feet and not going back up to your heart? Well, it is being pushed through, but then they have valves, and those little valves are preventing the backflow. So those valves close, pushes the blood up a little bit, valves close. And these valves are going to keep the blood to continue on an upward path. Here's a picture of what the arteries compared to veins, how it looks. You probably remember some of these terms from anatomy, physiology, the tunica, intima, media, and externa. We also have our lymph system. Think about like our lymph nodes, our lymph fluid. What is that for? Our lymph, that picks up all basically the waste, right? That's why our lymph nodes swell up when we have like an infection, because it's getting all that bacteria and all that junk. So your blood is going to be going through from your veins, your arteries, but all of those waste products, and along with all the lymph, the lymph is going to be going into the blood so that your blood can get rid of any of the waste. Talks about lymph nodes still. There's talks about the different lymph nodes. We looked at lymph nodes the other day in lab. And I think I gave you all a diagram of where different lymph nodes, like mostly in the face and neck, they're throughout your whole body. A lot of people always talk about, oh, check my lymph nodes right here. Well, you've got lymph nodes throughout your whole body. And this again just talks about the different lymph nodes here, showing some that are in your arm. There's some in your legs. See how they go all the way down. This is just goes through the interview process with the patient when you ask them, what medications are you taking? Do you take aspirin? What herbal medications do you take? Do you have people in your family have diabetes? Do they have renal failure? Do you have heart disease? Do you use cocaine? Do you exercise? Cocaine's a big one because people, you see a lot of heart attacks after people use cocaine. Exercise, that has a lot to do with how healthy your cardiovascular system is. Stress. People under a lot of stress really get stressed out. They have more cardiovascular issues. Eating habits. Are they eating healthy? Like with the red meat or the fat, alcohol, caffeine, smoking. All of these things affect cardiovascular health, right? Some things like rheumatic fever or heart murmurs, like especially as a child, these will help indicate like what kind of potential problems they may have. Cholesterol is definitely related to our cardiovascular health, right? Because of the plaque buildup. Problem-based history. This talks about, if you have a problem, their patient has a problem, or they have chest pain. Is it radiating? Especially we don't want that chest pain and then have it radiating down the left arm, right? Typical questions. What about things like, are you sweating? Do you turn pale? Do you feel like your heart is skipping a beat? Are you short of breath? What's happened before the pain started? What makes it worse? What makes it better? All these are our typical old carts type of question, right? Coughing. A lot of times coughing, we always think about lungs, but coughing can also be related to cardiovascular. So again, it's assessing the cough. Basically, what you are is you're a detective, and you have to get all of the information, all the facts, and put it together to try to determine what is going on. Urinating during the middle of the night. You think, oh, I didn't know we were talking about the genitourinary system. Well, we're not. Suddenly urinating during the night where you haven't had to previously, that's one of the first signs of heart failure. So getting up to urinate in the middle of the night, if it's just sudden onset. Typically, as people get older, they do start getting up in the middle of the night to urinate. But a quick onset, you've never had to have it, never had to get up before, that's kind of something that just needs to be checked out. Fatigue, is this a sudden onset? Suddenly you're just having problems with fatigue, unusual. What about iron? Are they maybe they're anemic? Again, talking about their heart rate, headache, pale skin, feelings in their feet and hands, muscle weakness, fainting. Did they faint? What happened before they fainted? Did they feel dizzy? Did they have chest pain? Did they have a rapid heartbeat? Were they confused? Swelling. Swelling is a big one for heart failure as well. Is your swelling, is it arms or legs? Is it in just one leg, one foot, or is it both? Is it unilateral, bilateral? What makes it go away? When you put your legs up, does it go away? Again, back to pain. We talk about all this. Any changes in your legs? Or your legs suddenly, they feel cold? Are they pale? Did you lose the hair on your legs? Do you suddenly have sores that won't heal on your legs? Any redness or warmth of the veins? That could be a sign of a DVT, a deep vein thrombosis, blood clot. Toenails. It's probably on the next screen. I always jump ahead, but look at people's toenails. If they're real thick and hard and yellow, they're probably not getting enough circulation down to their toes. We always look at their general appearance. Look at them. Look at their breathing effort. Are they panting? Are they huffing and puffing? Are they look pale? Look at their jugular vein. Their jugular vein to see if it's looks distended. We always look at their extremities for symmetry. The skin. Make sure that the color and temperature is the same on each arm. Look at their capillary refill. We check their pulses. Remember, we check pulses both arms, legs. We check them both at the same time to make sure that they are equal. Here's some of our lovely areas we check, our brachial artery and our radial artery. We're very familiar with those. Again, palpating bilaterally. We look at the chest wall. We check to look at the contour. We look to see if there's any retractions or heaving. We then check their apical pulse. We auscultate. We auscultate the heart, listening for S1, S2 heart sounds. We want rate, rhythm, pitch, any splitting. We will learn about all those in lab. There's an apical pulse. I say apical sometimes, apical sometimes. I think it's apical. I just always say it wrong, but that's where you find that. Peripheral vascular. Auscultate the carotid artery for bruits. Carotid artery right up in here. We're going to listen to it with the bell of our stethoscope. The bell of our stethoscope. Listen for a brewery. A brewery is like a swishing. You don't want to hear that because that tells us that there may be some sort of occlusion in that artery. Different things, the ankle brachial index, and we can talk about that in lab. I think they do talk about it in one of the videos. Again, we want to percuss, well, this is not part of our head to toe. We don't percuss the heart, but people who can do it. Different variations. Older adults, typically with older adults, we do the same exact thing as we do with younger adults. So some common problems with cardiovascular, obviously hypertension. A lot of people have hypertension. This is unfortunately very, very common. Hypertension is high blood pressure, right? That is blood pressure. It says higher than 120/80 in more than 2 occasions. Well, 120/80 is normal. Really and truly, it's if it's systolic is over 140 on 2 or more occasions. You can't go to the doctor, have your blood pressure taken, and it's 140, and they go, oh, you have hypertension, we got to put you on meds. No, it has to be on 2 separate occasions that it has to read higher than 140 systolic. Basically, this just again talks about periodic screening is important. Thrombosis, that's basically a blood clot. Thrombophlebitis, that is inflammation of a vein. So, and that could be from various things. It could be from trauma or injury. And it could be in usually it's in the deeper veins. Thrombosis, again, that's the word for clot, right? And thrombosis, we always think about like a blood clot in the legs, but you know what? People get them in their arms too. What is this? Oh, that's just showing thrombosis is a blood clot. A emboli is basically a blood clot that has broken free and is now traveling through your body. So a pulmonary emboli means that it has traveled into your lungs, and it can be life-threatening. Typically, if people do have some sort of emboli, it's detected on a CT. There's also some blood work, like D-dimers that look for blood clots, and the patient would be put on, most likely on a heparin drip to break up that clot. Sometimes they're given maybe Lovenox, which is a Lovenox sub-Q injection that goes in the abdomen, and it is also will break up that blood clot. Okay, so, and I'm not real sure, I got interrupted, so I'm not real sure where I left off, but basically an aneurysm, that is where the weakness in an artery kind of balloons out, and then you have to be concerned about it bursting, because if it does, then you're just going to have all that blood loss. That's an artery, so that's a quick way to die. People have brain aneurysms. The abdominal aortic aneurysm is very serious. That people basically, if you have an aneurysm in your abdominal aorta, a lot of times we call it AAA. Somebody has a AAA. Well, that doesn't mean they have AAA, the auto people that come out and tow your car for you. AAA is an abdominal aortic aneurysm. If it does burst, you can die in about 2 minutes. So usually men over 65, they might get an ultrasound, not that often, maybe once every 5 years. If they're a smoker, then it's probably going to be an annual thing. But we can listen with the bell of our stethoscope, listen to that aorta, and listen to see if we hear a bruit. If we do, then that's when we would have them have an ultrasound to see if there is an aneurysm, and if there is one, then it's measured, because if it's less than 4 if it's 4 millimeters or 4 centimeters, but I'll have to double check. But anyway, then nothing is done. They just watch it. They may do an ultrasound every 6 months, but if it's larger than that, then the person will probably have to have surgery, and they'll go in and basically clip it, and to make sure that it doesn't burst. All right, can I go to my next slide? Ay. See, I got interrupted here, and now I can't even move to my next slide. Rats. Oh, okay, well, how about that? I just touched it. Anything here? Abdominal aortic aneurysms are mentioned here. A thrill or a bruit. A bruit is, like I said, that swishing sound. A thrill, often you can feel a thrill. If anybody knows somebody that's going through dialysis and they have an AV shunt on their arm, feel it, because it's literally like vibrates on your fingers. It's really kind of cool. Alrighty, come on. And once again, I can't make it move. There we go. Alrighty, so you can have, heart disease. You can have heart disease with the muscle. You can have problems with the blood flow. You can have problems with the electrical conduction. You can have problems with the arteries that supply the blood to the heart muscle. You can have problems with the valves and different things with the valves. You can have a stenotic valve, stenotic, which means it doesn't open completely, incompetent, meaning it doesn't close completely. Some certain things, like if you had rheumatic fever as a child, or if you have endocarditis, that is a big issue with valvular heart disease. A lot of endocarditis is from IV drug users. Usually IV drug use, they get using sharing needles, and then it causes in the like pathogens within the blood. It gets into the heart, it attaches to these valves. The valves will grow vegetation, and it literally looks like mold on the valves. It's nasty. They have to have IV antibiotics for quite a while to get rid of this infection. And because if they have a history of IV drug use, and then now they need IV antibiotics long term, they usually have to stay in the hospital, because we're not going to put in an IV or a PICC line and send them out, out on their way, send them home, because they're going to be shooting themselves up full of drugs. So a lot of times they have to camp out at the hospital for several weeks until their therapy is completed. Angina is it's chest pain because of ischemia of myocardium. Okay, there's some medical terminology words for you right there, right? Ischemia means lack of oxygen, and myocardium. Myo is muscle, cardi is heart, right? Heart muscle. So basically means that the heart muscle is not getting enough oxygen. And so when it's not getting enough oxygen, it's going to hurt. So they're exercising, or out raking the yard, and suddenly start having the chest starts feeling a little tight and some chest pain, probably because they're not getting enough oxygen. Now you got words like ischemia or infarction. Myocardia ischemia means there's not enough oxygen getting to the heart muscle. A myocardial infarction means that there's no oxygen and the tissue has died. And once tissue dies, it doesn't come back. So people that have heart attacks or myocardial infarction or an MI means that some of that tissue has actually died. Typically, it's caused by atherosclerosis. That means basically the coronary arteries build up the plaque, a lot of times from high cholesterol, poor diet. And when that plaque builds up, the blood flow is compromised and it can't even have a complete occlusion where blood flow cannot go through. Patients typically do say it like squeezes. It feels like squeezing. Some people say, oh, I feel like I had an elephant sitting on my chest. With angina, they will have it with exertion, but once they rest, they sit down, prop their feet up, they feel better. The pain goes away. So that's angina. It just, it's that lack of blood flow, and once they start resting, they're okay. Here's myocardial infarction. This is what I was just talking about. This is when it's actually has death of the myocardial cells or the heart muscle. Worst chest pain ever experienced. Pain lasts longer than 5 minutes, often radiates to left shoulder, jaw. However, women have more GI upset. They don't really have the classic symptoms of the shoulder or the jaw. Often they feel like they have, they'll feel like they're, nauseated. That was Lisa Marie Presley, who passed away back in January. They said, oh, she was not feeling well. She was having some stomach upset. And then she died of a myocardial infarction. And that's because typically with women it is a little bit different. Says pain is not relieved by rest or nitroglycerin. Nitroglycerin opens up, just dilates all those veins and arteries. It dilates everything and gets the blood flow going. So if it's not, nitroglycerin does not relieve it and you're still having pain, you need to get to the emergency room. Heart failure is when basically the heart is not able to pump blood efficiently. So it's basically just meaning the heart that's a pump is not doing what it needs to do. And it can either be left-sided or right-sided heart failure depending upon what's going on. People will have edema or they'll have issues, lung issues. Sometimes it'll back up where they'll start having a lot of fluid in their lungs, and that's congestive heart failure, right? They start having the fluid back up in their lungs, or they could have the peripheral edema. Now, this is the thing, you need to remember this. Left-sided heart failure, left starts with L, that's when it is in the lungs, left and lungs. So left-sided heart failure, you're going to have, your effects are going to be seen in your lungs. Right-sided heart failure, right starts with R, think of rest of body. That means you're going to have edema throughout the rest of your body. So that's where people are going to have the peripheral edema. That would be the right-sided heart failure. Left ventricular failure, that's different causes of that. I'm not going to go into this too much because you have med-surg next term. But again, fatigue, shortness of breath, right-sided heart failure, reasons for that. I'm kind of skipping through that. Infective endocarditis, I talked about that. Ooh, there's some where it kind of looks like the leaflets on the valves. And pericarditis is inflammation of the layers of the pericardium. We'll talk about this more, especially the pericardial friction rub. And that's about it for this